dryness, sometimes drought, shifting of seasons, and we need to take part in activities that will basically allow us to live and adapt to that new environment and those new circumstances.
Right, and here's where risk reduction comes in.
Right, so disaster risk reduction is a concept that aims at reducing the likelihood of a disaster occurring. Disasters are very much a developmental issue. Disasters can affect development, it can retard economic growth, it can impact industries, and therefore it is important to reduce the risk of a disaster occurring.
Another of the facilitators, Barbadian Gail Drakes, highlights the importance of gender and climate change in the work plan.
And gender is particularly important because gender, when I say gender, I don't mean necessarily just women's affairs, but issues that are related to both men and women have an impact on how vulnerable you are to disasters. And we want to be able to work that kind of consideration into the various aspects of the work program. Because we have to recognize that whether you are male or female, and based on the roles that have been ascribed to you by your society, it puts you in different positions. And it means you have different access to resources that can help you recover after an event. It actually may put you in higher or lower levels of vulnerability. This is before you're even impacted by an event. So these are things that we need to take into consideration when we're developing our work programs.
A third facilitator, Senior Program Officer of SEDIMA, Saudi Rahat of Guyana, said that the program is seeking to develop a comprehensive disaster management strategy which will impact positively on the region.
We're seeing at the national level here, the stakeholders are looking to achieve similar results. For instance, we spoke about building the community resilience. There's a component in that. We're also looking at the whole issue. Today we had an extensive discussion, for instance, on the whole issue of how do we promote the land use, the land management, or the land use planning arrangements here. How do we ensure that building codes are enforced? How do we promote having a land use policy and all the supporting instruments, laws and regulations, etc. So we're seeing a similar approach, like with the national, with the regional results are trying to achieve. Again, sector mainstreaming. So we're looking at it from every sector, what they want to achieve.
The fun of the exercise was lively and stimulating.
Their involvement has been quite amazing. There's been so much vigorous discussion, feedback, very intelligent, very analytical views. There have been people who have come from a wide variety of backgrounds. So you have persons who are very knowledgeable in concepts. So it's been quite a fruitful discussion. It's been quite a fruitful few days.
Much of this workshop is about climate change, and I think what this particular group of participants has been, I've been extremely impressed with is the level of discussion and the level of analysis of the issues related to disaster management and climate change adaptation. Very pleased about that with this workshop.
Participants have described the exercise as wonderful. Health official Osbert Charles welcomes the opportunity to build capacity.
Yeah, I think so, and I think it is very good for us because we are now able to pull the sectors together. We are now able to identify the issues confronting these sectors, and as a nation, we are now better placed so that we can share knowledge. We are now learning about how that we should build back better. We've been using the term build back better, but when we explore what the issues right now, we are realizing that even our building codes, they have to be upgraded. So by sharing with the various sectors, it is really beneficial to all of us.
Hubert White, who represented the Met Office, applauds the exercise, saying that it was timely.
Climate change studies and climate change activities is a win-win situation. For example, we think about going more renewable energy that will have an economic factor and an environmental factor. So it's a win-win situation. We have nothing to lose by adhering to the advice of climate change.
Your thoughts on the workshop?
Very informative, and I think it's lively, and that's what I love. We exchange ideas, we have debates. We do not agree readily, so we allow the facilitators to explain themselves very explicitly, because we are not accepting things just like that. We are diving deep into the situation as true scientists.
We've been armed with the tools to really chart the way forward, you would say.
Yes, but what we have to do when the facilitators left, we must chart the way forward.
Grenada now has some of the tools necessary to build capacity in mainstreaming climate change in disaster management through climate smarting. I am Trevor Thwaites on the ball for State of Affairs.
This is the Grenadian reality. This is our current state of affairs. Health officials in Grenada have been waging an aggressive campaign to ensure no local transmission of the chikungunya virus. Transmission has already been reported in about 15 Caribbean countries. So far, Grenada has had no reports of mosquitoes being infected with the chikungunya virus and being spread to persons. Officials are bent on ensuring it remains that way. Kevil Frederick went on the front lines of an ongoing war to deny entry to Chikvi.
In January of 2014, the region went on alert as red flags went up warning of the threat of a mosquito-borne disease known as the chikungunya virus or CHIKV. Pan American Health Organization PAHO and the Caribbean Public Health Agency CARPHA told affiliate states, including Grenada, to implement measures geared towards the prevention and control of the disease, which is being spread by the Aedes aegypti mosquito. State of Affairs learnt that whereas some of Grenada's closest neighbors such as St. Vincent and the Grenadines and Trinidad and Tobago had outbreaks, the Spice Isle managed to keep the disease out, although the mosquito can be found in Grenada. Here is what we found out. Dr. Francis Martin is the Director of Primary Healthcare, and a few weeks ago, he and Dr. Kester Dragon, Medical Director at the General Hospital, flew to Guadeloupe where they participated in an intensive training on the clinical management of chikungunya.
Chikungunya is the name given to a particular virus. It's a particular RNA virus that has its origin in East Africa. The name itself, suggestive, was coined by the tribe in the tribe that was affected by this virus in the first instance, many years ago. The word actually means that which bends, and that suggests that it affects joints and causes you to, your hands and feet to be bent in a certain way, and that's really the origin of the word chikungunya. But really and truly, it's the word that is given to a virus that has the ability to infect the human body. The very first sign and symptom which most persons will have is a very high fever. In fact, about 76 to 100% of the patients that are affected with this virus will start with a very high fever. Thereafter, you may also develop very painful joints. The small joints of the hands and the feet are particularly infected, but it can also affect the larger joints like your knee and your elbows and your back. Persons may also experience muscle aches and pain, back pain to a certain extent. And then a smaller number of persons may experience a rash on their trunks or their extremities. Some may have vomiting, nausea. Some may even have a conjunctivitis or a red eye, as we may call it.
Mr. Kenny James is the Senior Environmental Health Officer. The man in charge of the Ministry of Health's Vector Control Department tells us what his officers are tasked to do in the fight against CHIKV and other vector-borne diseases almost on a daily basis.
Our team goes out on a routine basis every day, trying to identify and treat wherever possible we have Aedes aegypti mosquito. This is the way in which we can minimize the risk of transmission of the chikungunya virus here in Grenada. What we do realize is that time and time again, people tend not to take heed of the common breeding sites found. For instance, we may inspect places where you have tire shops and you find breeding of Aedes aegypti on a consistent basis.
Whenever such outbreaks become an urgent priority for countries in the region, organizations like PAHO and CARPHA must put their machinery in operation. Dr. George Mitchell is the Chief Medical Officer in the Ministry of Health.
In terms of the regional situation where chikungunya is concerned, you would be reminded that the first case of chikungunya was reported in St. Martin in December of 2013. And since then, we have had cases reported almost throughout the region, from Antigua and Bermuda, St. Kitts, come down the chain. It is as though the mosquito and the condition is flying down the islands of the region.
Dr. Mitchell, who also has first-hand knowledge of the spread and control of the virus, summarizes the present regional and local situation.
Based on information from CARPHA, as of the 19th, which was the day before, in the region we have had about 5,000 confirmed cases of chikungunya. And in St. Vincent, which is our closest neighbor, thus far they have had, as of Monday, 3 confirmed cases of chikungunya with about 24 suspected cases. So that is the regional situation. And just to go back, we have not had any confirmed cases in Grenada. We have not had any serious suspicious cases either.
In times like these, specific attention is given to our ports of entry, since oftentimes such diseases are carried by humans who were exposed to high-risk areas. So State of Affairs had a quick chat with Inspector Marilyn Ferguson of the Immigration Department, who spoke about their collaboration with the Ministry of Health in this venture.
We would have received some pamphlets from the Ministry of Health as it relates to chikungunya. We would have distributed that to the various ports, mainly the Morris Bishop International Airport. Officers there are urged to speak with visitors as it relates to the chikungunya, have the pamphlets distributed. Persons coming in, they would have questioned them or asked them if they were exposed to the mosquitoes or if they have been to countries where the disease was reported. If that be the case, they will advise them to see the nurse that is present at the airport. Up here at the office, we do our own thing where we sensitize the staff as it relates to chikungunya. Persons are asked to take the necessary precautions even at their homes to see how much we can eradicate the breeding site of the mosquitoes.
Meet Dr. Martin Ford, a professor at the Public Health Department, St. George's University, and member of the National Task Force set up by the Minister for Health, Dr. Clarice Modest-Cowan. Ford tells us what he thinks is his department's role and why other stakeholders may need to get involved, perhaps at a later date.
We were very glad that the Minister of Health and the Ministry of Health in general has historically, not just now, but in many times in the past, involved the Department of Public Health and Preventive Medicine within St. George's University to participate in matters of national interest. I would say that the Minister of Health, through her CMO, the Chief Medical Officer, has already put together a task force that involves, I would say, a wide breadth of stakeholders. I would speculate that as we become more involved in tackling this enemy, more will have to be involved.
Luckily for us in the Spice Isle, we have not recorded a single case of chikungunya since news of the outbreak broke in mid-January. The fact that this country has not recorded a single case of CHIKV did not come by chance. By all indications, the Health Ministry seems to have made adequate preparations.
We have not had any cases, but we want to make sure that if there are any imported cases, that our readiness, our preparedness does not allow for massive spread.
I am Kevin Frederick, and this is State of Affairs.
And that's our picture this week from the home front. That is the current state of affairs. As we speak, our reporters and producers are gathering more stories from across Grenada. We'll be back here next week to tell them. Until then, I am Tahira Natalie Carter.